and welcome to Health Impact Digital Health Talks. This is Megan Antonelli, the CEO of Health Impact Live, and we are excited to talk to Nora LaTorre today, the CEO of Eat Real. Nora is pioneering data-driven approaches to revolutionize school nutrition programs and improve health outcomes for the next generation. I got a chance to meet Nora and hear her speak about a year ago, and there's just been so much excitement and movement in this space that I'm delighted to have her on the show. Hi, Nora. How are you today?
Great. Thank you so much for having me and for having this important conversation take place.
Yeah, I think when it must have been either a Health Impact or another conference a couple years ago, really just coming out of the pandemic, where I heard the phrase food as medicine, and it just spoke to me so much. And then I started kind of looking into it and found, the work that you're doing, with Eat Real and the schools. And I love what you're doing. And so I want to make sure all of our listeners are aware of the program and how they might get involved. But tell us a little bit about your background and how you got there.
So my background is an interesting combination of for-profit, nonprofit, government. And so I started my career actually at Target Corp after studying movements. So I'm really been curious about movements and how do we come together to do good in our world. And I went and worked in corporate America because I felt like corporate America had the opportunity and big business could move and do good the fastest. And so I learned so much, and I helped pioneer some sustainability there, and really loved having my beginning. I am Minnesotan, so also starting at Target Corp in Minnesota was a nice launch. And I worked and helped build the fair trade movement, kind of taking that from niche to mass. And that was all about activating major brands and retailers to respond to demand for conscious consumerism and creating better for you, better for the planet products. And so that was a lot of fun to scale that movement. And I live in the Bay Area, so you can't live in the Bay Area without working in tech for a little while. So I started my own app. I had a very cool app, and I learned a ton about agility and speed to market. And it was really fun to be in that space. And I also worked in agtech, really bridging the world, my background in food and tech, and got my boots dirty on a lot of farms throughout our country, and learned a lot about our U.S. food system. And about that time, I was pregnant, and one of the board members of Eat Real saw me in action, very, very pregnant. I think it was like 8.5 months pregnant. I was stirring up and building community in ag and trying to, change the status quo. And they told me about Eat Real, and I fell in love with it because it was started by the top doctors. And while I had worked in food, I don't think I realized how sick our kids were. And when I became a new mom, I had to be a quick study on nutrition. I learned that our kids are on track to see 693 fewer sunsets than we will. In medical terms, that's 2 years less of life expectancy than we have. And when I learned that as a pregnant mom, I thought, what world am I bringing my daughter into? I want her to have a longer, healthier, happy life than me. I have to do something about it. And it turns out that food is the best way to expand human lifespan, the planet's health, et cetera. And so when I learned what Eat Real was up to, I was like, give me the keys. Like, let's go. This is such an important thing. And if there was anything that was going to take me away from my family, and I wanted it to be the cause of my lifetime, and I felt like Eat Real was really works with the best doctors, works with the best thought leaders, data driven, and was onto something big. And so I came in as a co-founder, and five years ago, almost 6, we decided to just go all in on kids' health and working with schools and changing our food system. And we've had this tremendous growth, and it's been truly my dream job. And I love what we're building with our community.
Well, I do too. I mean, it's such an important place, and we're all about impact here. So finding that place where you can make the most impact. And I think what kids eat, and using and leveraging the school programs is such a brilliant and wonderful way to go about doing that. And in that 5 years, I'm sure I've seen even that the beginning discussions of social determinants of health, which was maybe a little bit more than 5 years ago, where the health system has started to focus on that. But at the time, I think because of the, certainly from the provider perspective, right? It
Yep.
was like, how are we going to collect that data? How are we going to look at that data? And now the technology is there, where the systems are in place. A lot of, the EHRs are collecting it and things like that. From your perspective, having had a tech background as well, like what are some of the tech tools that are enabling, Eat Real and other programs like that to kind of help with these school systems?
Yeah. And I'll talk about our kind of how we're very tech driven and how, and my co-founder, like, I'll talk about that in a second. I just you made me think about, this like data gap that we have today and how we have with AI and with, government systems and with so many new tech tools, we have the potential to leapfrog, I think, in terms of measuring baseline population health, breaking it down. Between now and five years, I think it's going to be a whole health data revolution in terms of what real time, and between people, getting their real time personalized feedback from their Aura rings and from their levels on their CGMs to government data on population health, et cetera. And right now all the data is very hidden in sub databases and it's really hard to extrapolate, but I think we're going to be able to get better real-time data on people's health. And I'm so excited about that. And then be able to make informed structural decisions as a government, as providers, as nonprofits, et cetera. So I'm really excited about, what it's going to look like in just a couple of years. And it's really,
Yeah.
I was just at the conference doc and we actually did a workshop thinking about the data evolution. And it's so exciting to me.
Yeah, no, it's amazing. And I mean, especially things like the Aura Ring. And, obviously we've had our Apple Watches forever, but I have to say, and not to do a plug or commercial for Aura, but, it really, because it's on all the time, you really see things. And and just in the recent weeks where we've had the Surgeon General coming out about alcohol and cancer and health, and whereas certainly my generation, maybe I logged on to, I leached onto that the news that a glass of wine every night was good for you, very religiously. I mean, shaped my adulthood for sure. And, wine is not a health food. And, it took the Surgeon General's news was not new because the Ring told me that,
one glass of red, maybe one glass of red wine, or a mezcal margarita, and I go for a walk and I drink some water and I'm fine. But regularly, or if I don't do those things and I just have that celebration cocktail, I see it immediately. We already had the data in our hands to see that it affected our HRV, our resting heart rate, our overall sleep score, our resiliency. Yeah, no, it's so significant. And that data, really, it changed, literally changed my behavior, over a few nights. It takes time, and we're all.
Oh yeah, no, it's crazy. But yeah, no. So tell me a little bit about the technology that you guys use there and how that supports the program.
Yeah, so we do kind of three core things, and I think that might help explain then how we designed our tech stack to then support the data. So we really focus on changing and doing advocacy at a national and state level. So that's about policy change and systems change, structurally systems change top down. So for example, we helped pass the first sugar standard ever in America's history, first in California, and then nationally. We just passed the first food dye bill, and now other states are starting to adopt it. And then we just saw that the FDA may address food dyes. Most recently, California just championed an executive order on ultra processed food. So how do we support that and move that across the line? And so those are just three quick examples within the last year where we leveraged the data from our program and then turn the data from our program to show demand and how much constituents want change into then policy. And so policy is one important part that we work on. And then we also do awareness building. And so that's really about getting data and insights out to people so that they can make informed decisions. When you hear that our kids are going to see 693 fewer sunsets, or then when they're going to see that many fewer and live 2 years less than we will, you can't unhear that, I think. And so how do we take that CDC data and then put it in a way that resonates. Like, I'm a sunset chaser. And so like that, it's like every time I almost cry when I think about that, because I want to fight for more sunsets for my kids. And so thinking about how do we use data then to compel consumer action and individual action. And then the core thing that we do is we go and do grassroots food systems change. So kids today, about 50 to 100% of their calories are in schools. And so if we can, our theory of change is if we can change those calories and make them nutrient dense, healthy, sustainable, delicious, culturally relevant, and kids eat them, then we'll change their health trajectory. And so we work with schools around the country, and we've gone from 50 to 500. And now this year, what took us 5 years, we're about to go from 500 schools to 1,000 nationwide, from 10 states to 20 states in one school year. And so what's really powerful is that we put data in the hands of those community leaders in those schools, so that then they can make a food action plan that works for their constraints, for their students, for their school food businesses, which are the largest restaurant chain in America. So if we can give better data to the largest restaurant chain in America and incentivize them to go move those data points towards healthier, more sustainable options, we're going to change our food system and the health trajectory. And so we assess school districts on our 10 standards and about 34 data points, and we give them this really robust report. And then we help them create a food action plan, and then we remeasure. So we get a pre and post. It's a really powerful. So for example, one of our schools just removed 34 pounds of sugar per student per year. So, and we could see the before and after, or they went from 5 local vendors, so farmers, to 11, which is keeping those dollars from the largest restaurant in that farming community, in that region, and you can measure that. And so it's really powerful but I would say 5 years ago, we were in a lot of spreadsheets. It was pretty clunky. We were figuring it out. Figure outability is one of our big things. Like, we'll figure it out. I think we say we'll figure it out about 20 times a day, maybe more, maybe in just one meeting. But we were in a lot of spreadsheets, and the data was very disparate. And now what our team has done is that using machine learning, and they've increased the data efficiency over 60%, almost 70%. And so we're leveraging things like using our schools simultaneously have started to leverage more of a tech stack and more tech tools too. So now they have more databases, and we can pull from their databases. We can use things like PDF readers and AI to synthesize the data, to collect the data, to synthesize it. And so our team is always, how can we be more efficient? How can we take less of our school's time because they're busy feeding lots of kids? And how do we use our teams, our nonprofits, small resources the best that we can? And so that's been really interesting, and just in terms of the data, and then thinking about the core thing that we do, like how do we also then think about our own nonprofit tech stack. And so, we're on Slack right away. We just migrated to Rippling, a PEO, where instead of, having to run payroll with 20 buttons, we can click one button. And instead of having, to think about changing passwords, we have, a different a security system. And so thinking about how to, our nonprofits tech stack, using things like Slack, Rippling, Asana, Figma, et cetera, have been game changing for our fully remote team's efficiency.
Right.
And
it's amazing.
Peace of mind too.
It's amazing what some of these technologies and tools have been able to do in terms of that, but certainly with respect to data and data analytics. And I wonder, you have me thinking about all of the levers that could be impacted. Like, are you seeing, and do you measure, like, within the schools? Obviously there's, health, but like in terms of their own KPIs, like attendance or performance and things like that, are they seeing positive results like that? And do you help, kind of with that, or do they come back?
We started more and more data collection beyond just our standard audit. And so looking at things like participation is really powerful. So what's amazing is we've seen that as schools improve their school food and the parents and students like it and trust it more, they've increased their participation, which is the number of kids saying yes to that, wanting school lunch, basically saying yes and going and having school lunch. And as a result, our schools have gone from, in many schools, not every school, but we're working on some case studies right now, so I can't share everything, but some of our schools were in the red, and schools are tasked with being profit centers. They have to at least break even because they can't pull from teachers' budgets, classroom budgets, et cetera. And so they went from being slightly in the red to now in the black. To the students, like, they were $200,000 in the red, one district, and now they're $700,000 in the black. And so they're able to show that they can have a better business model if they invest in high quality real food. It doesn't always have to cost so much more, but they're upskilling their staff, they're getting higher quality ingredients. Sometimes they make it strategic investments, grow their food budget slightly, and but then make more revenue because they have more participation. So that's something that we look at. And then we're launching some very exciting research partnerships, which we're looking at some like working with some of the best institutions in the world. So this year we're launching a medical advisory council. And so we're working with those top researchers and their institutions, whether it's academic, et cetera, to do research on our program. And so I'm so excited about some of that because we'll be able to do like mental health surveys with kids and understand how did better food at school change their health, and we can already pull some academic test scores and truancy and behavioral issues and nurses' office visits. Like we can already pull a ton of data, but then how do we work with external institutions and some of the top researchers to show even more the case for this? And so we're looking at everything from behavior change to mental health impact to preferences, et cetera. So I'm so excited about the research, and there's a major research gap. So I think like just showing what's possible. And then there's so much more we could do, right? Especially with wearables and everything else. Like there's so much important research that needs to happen. And as a mom, I want that information about my kids and what's
Right.
my kids and my community too. So I think parents and more are going to be hungry for getting more information about what works for kids.
Yeah, no, I mean, that's when I always think when my sons are 6 years apart.
Mm,
And when I had my first son, it was kind of like pre everything being organic and sort of pre this sort of kind of organic food movement
yeah.
in mass market. But then it happened, and and then with my second, it was very much so. And then sort of in the middle, all of my friends kind of had kids, and kind of educating myself and them on all of that. And yeah, I mean, as you said, when you think about this, the sunsets they're going to see, like all of a sudden it really matters, when it's just you and you're in your 20s and 30s, you don't think about it as much. But when it's about your kids and what you're putting into their bodies, it's so, all of a sudden the world opens up and you realize. And I think at the same time, Michael Pollan's books came out and I was reading all of that and seeing it. And I had this sort of aha moment where I was away on vacation, and it was like we went and we were at Club Med. So it was and it was like President's Week. So it was like Americans were there the half week, but we had to save money. We had gone like a half week and then the other half week, and the Europeans came the second week.
Yeah.
And it was literally like watching, two different species walk in and walk out. And at the same time, I was reading Michael Pollan's book, and it just like it all went, oh my God. No, it didn't immediately change my behavior, but I removed trans fats and all of that stuff. But and food dyes became a big, focus in our house and all of that. And that was,
We're actually calling it American health collapse. Like what you saw and felt and the experience that you had, like when you look at the data, we do spend the most on healthcare with the worst health outcomes. Life expectancy peaked in 2014. So 6 years prior to COVID, life expectancy started to go down, with the biggest driver being preventable ultra-processed food-related disease. And not only did life expectancy then start to decline, but health span and then happiness span. So measurements around how many healthy years do you have, how many happy years do you have, like all going down. And so that phenomenon, we're actually, calling American health collapse, because like something that's so American is to give your kids a better life, or at least as good of a life as you had. So I think innate, and it's like very primal to like fight for your kids. And we're by so many measures not able to say that we can do that right now. And so I think it's a rallying cry, and it's causing people across the aisle to come together, and people across business, nonprofit, for-profit coming together to scale solutions that work.
mm-hmm. Yeah, well, that's so, I think it is. And it's just, and, I think there was a study this year too about that, and just about our numbers being so, sort of disappointing given how much money we spend on the healthcare system, and so we're spending it all at the end instead of, doing the right thing from the beginning, and certainly, well,
9% of our GDP, it's over $3.5 trillion a year. Like we spend on preventable diseases.
So when it comes to that, and so much of it is, and I have so much appreciation for the policy work that you're doing, because that's, a lot of it happens there, right? I mean, the food system is not built in such a way that gets healthy food on plates, whether they're at home or at school, or on the way home from school, if you will. I live in a town where people are very focused on health, and yet there is a McDonald's across from both high schools. I mean, and I just think it's a crime. But with the food dyes and that legislation that just passed, when it comes to where the data and the analytics were to kind of make that, like, how does that become, you sort of studied the movements, right? Like, how did that get to a place where the legislators actually did something?
Yeah, and how do you kind of do culture change and shift the zeitgeist and demand and whatnot? I think, individually, people caring matters so much. So I think you coming back from your vacation and talking to your friends about it, like, that matters. You reading the book and giving it to 3 friends and having a book club on it, that matters. And so I think that started to happen and around American tables for years. So like that has, and this feeling, this kind of gut feeling that things aren't right and that our food has a lot to do with it. There are a lot of things, like the technology also, people are feeling that has a lot to do with it. It does. Like, you have this kind of, this gut feeling, and individuals started to make change. So I want to acknowledge, like, I really believe that individuals do create ripples, and that now it's creating a swell. And so there have been incredible visionaries who have been ringing the bell saying there are problems here. And that's visionary moms and that's visionary, certain leaders that have taken a stance, and companies that have said we're dye free, or that shown that there are alternatives. And then what was really exciting is, like, over the last 5 years, we've been working with these school districts, and they remove food dye. So it was really pivotal with the first food dye legislation that Jesse Gabriel and that especially Gavin Newsom then championed, was that our school districts were able to say to lawmakers, which then was pivotal in passing the legislation. They were able to say, we already did this. So our school districts were ahead of the game, and they call themselves the Eat Reallys. 400 schools in California already took out food dyes. And so they were able to say, we already did it. Our participation is up. Parents are happier. Students are happier. We're hearing from teachers that the kids are focusing better, that there are fewer behavioral issues. We have already done it. It's better. It's better for our school food business. It's better for our students. Our communities are demanding it. This is feasible. There's interest, and we already did it. So let's just do it as a state. And so that to me is like an example of, like, how grassroots builds, and then individual leaders that are willing to say, I'll champion this. And then working together with a lot of other nonprofits. We worked really closely with Environmental Working Group, for example, and coming together in coalitions, and then getting different experts. So we have, we brought in medical expertise and quotes from the top mental health doctors that said this is really critical for kids' health. So we had the data, the grassroots, the top researchers, and then political leaders that all came together and said, let's move this forward. And so I think that's just an example of how, and it can happen quickly. Like, that's within years, we've seen that kind of change. So our food system, when you think about time, like, we had a real food system, and then it's become an ultra processed food system only in the last 50 to 70 years. And we can quickly make change. We see schools start to transform their food in less than 2 years. Like, it can happen fast. One school district in Washington State is joining our program this spring. And they, before even joining, are like, we're already working on it. We're making changes. We've already made changes. So it can happen quickly. And you see it. What's really powerful, I think, too, is like, just something I've been thinking about, the power of human regeneration and planetary regeneration. But we regenerate, like, in so many ways. Of course, we age, and in some ways we don't. But Dr. Robert Lustig, who's our chief science officer, did a UCSF study that showed when you just removed added sugar from kids' diets and left starch, like, what didn't make it that much, that much better. But we're just removing sugar. Which kids eat a bathtub of added sugar a year. So it is really important to remove added sugar. Another thing you can't unhear, 65 pounds of added sugar per year. When they just remove sugar for 10 days, their metabolic health transforms. It's really exciting that we can make change quickly, structurally, and it will quickly start to transform the health trajectory. Like, we can heal Americans. We can restore our kids' lifespans and health spans. We can get kids back in the classroom and on the field instead of in the doctor's office. And we have to, because our kids are so sick right now.
Right. No, it really is. And it's so, I mean, I think the fact that the data shows, that you can measure the impact so well and so easily, and that, in essence helps create the movement, right? And it helps drive it when everybody can just see it that clearly. Even though we might have gone and you mentioned technology. And I think, when we think about the timeline of that, 2014, where our health sort of starts to fall off the cliff, it certainly had to do with where some of these smartphones and kind of ever present, sort of always connected kids has happened too, and it's such a double, it's two sides of the same kind of health piece of that. But, at the end of the day, some of the food choices that they make are impacting their technology behavior and other, otherwise,
Yeah.
so, and the not going out and, kind of getting the movement and the exercise that they need. And then tying that, of course, to, you talked about the lifespan and where that comes in. So, there's a lot, but when you can see an impact with small changes. Tell me a little bit about how, I mean, you said you went from 400 schools to 1,000. So that's a big scaling challenge. I love Slack and Asana, but it can't all be put on them. So tell me a little bit, one, about how do schools get involved, but also then how are you, implementing these programs in so many different schools?
Yeah. So our team I love what nerds we are and how data driven we are. And so all 100,000, about 100,000, 97,000 schools are organized into about 13,000 school districts. So our team has actually used data to analyze those 13,000 school districts. And we've sequenced it down to 200 that we would love to work with based on size, location, variety, health risk, planetary health risk, like community sustainability, demographics, historically underserved populations, and we basically we have a map of kind of dream districts that show that this works. And so we are really strategic about, and we meet every single, every week about where we intentionally strategically want to work. And then also there's a lot of serendipity too. You can't plan for everything, or there's not you have to leave room. We say leave room for magic as one of our values. So we're extremely data driven, and we also leave room for magic. And so it's a combination of highly strategic and wanting to work. So we're launching in Alaska right now, and we're launching in Georgia, Alabama, Louisiana, Oklahoma. So when you look at ultra processed food related disease, it disproportionately impacts the South. And when you look at COVID hotspots, et cetera. So it was really important that we work there. It was also important that we show that this can work in more isolated winter, and so we have this strategic map, but then it's a combination of that map with looking at district readiness. Where is it feasible? Where can we have some people that are leaders or want to become leaders? And then also being able to, people reach out and they call me, or they reach out on LinkedIn, or they email our team. And so I had, for example, down near you in Southern California, in the ninth largest school district, about 42,000 students, Lynn Choi calls me, and she's a mom, and she was like, Nora, I'm driving my kid's lunch to school, and I love him so much, and I'll do this every day, but I don't think I should have to, and I don't think any parent should have to. And I think our school lunch should be better. And what can I do to help? And can I bring eReal to my school? And I said, well, here's the email, and we have a template that people can reach out to us for. Here's the email that you can send. First of all, we have an attitude of gratitude. So we encourage her to thank her district for everything that they're doing today, because they work really hard and it's a really hard job. And then present us as a resource. And we raise philanthropic capital, and hopefully we'll have more health system leaders getting involved and government grants, et cetera. But we offer our program free of cost. So she was able to reach out to her district and thank them, offer support, and then present eReal and say, can I connect you to eReal? Or let me, here's the eReal team. And within 12 hours, her district was signed up. And Capistrano is now one of the most go-get-em districts out there. They have the prettiest organic food map that I've seen and that we've helped them work on. And they are incredible champions. And now they want to get the whole region involved, and they're go-getters within the state and the nation. They are unstoppable. And Lynn Choi was that spark. And so we want to leave room for those sparks and that magic. While Capistrano wasn't on our immediate map. But it was, so that's where it's a little bit of in cooking, super strategic measurement. And then also heart. So that's where it's a combination of, or someone heard in Connecticut, heard of one of our doctors and on Huberman and reached out. And so, or like, how can, and or in this podcast, hopefully someone will hear about Eat Real and they'll reach out, or I'm at a conference and I'm speaking, or they reach out to me on LinkedIn and they say, I want to get my school involved. And so we start the process. And even if it's not their school, where in their state would make sense. And how do we now have this network of not only Eat Realies, these food service directors across the country who are getting their friends involved, but these community leaders that want to make change and want to see action happen, that are helping expand Eat Real nationally.
Right. Well, that's great. Well, I'll have to connect you to the Beach Cities Health District here so we can get to in Hermosa and some of the surrounding schools. It would be great. But I think, and that's what I thought, but I wasn't sure because it's, and that's, what a great way, because of course you're targeting the schools that need it most and maybe have that right combination of readiness. But then obviously if school districts are interested and have someone who's able to kind of champion it internally, they can get it happening in their own district.
Yeah.
Around
We're using tech to develop new programs because we don't work in private schools yet. Like, how do we adapt Eat Real to have a private school system model, et cetera? So we're trying to also kind of think about and new tech that can help us reach even more schools so that we can have our deep dive, but then we also have tools that get community started everywhere.
Right. And then, I mean, I even think about even like those sort of the graduate school programs and the things, to get in from the places of where teachers and school administrators are getting educated, to like make sure that they're getting that education now so that we can just start from the beginning with the next generation of educators and leaders in the system. One thing I saw recently, I don't know whether it was a post of yours or an article, but something that I think about too, having teenage boys, is that we've heard about kind of the fertility issues and puberty issues around these foods. And so, tell me a little bit about the data, the trends that you're seeing and kind of what people can do and what you guys are doing.
Yeah. I'll start with a little bit of a children's health overview, and then I'll go into the specific question about puberty, because so our children's health status is that they are on track to have shorter lifespans and health spans. What the problem is that we're starting to see formerly adult onset diseases that used to happen to people in adulthood are happening to our kids at extreme rates. So, and that's not me being like inflammatory like this. It's when you look at the data. So right now in America, 3/5 of kids will be obese by the time they're 35. So we're not just overweight, obese. And that then is like when a lot of people are thinking about children, et cetera, and then there can be a myriad of challenges that make that more difficult. And then we're seeing type 2 diabetes, I mentioned, is up 77%, but then we have pre-diabetes soaring in kids. And then you have things like fatty liver disease, which people used to develop fat around their liver and get fatty liver disease from alcoholism, but now kids are getting it from sugary beverages and sugar, ultra added sugar. And those are and chronic kidney disease. And so we're seeing just these issues that used to be towards the end of life now happening in the beginning of life that are then causing major health challenges. And I don't want to say that it's just the food, like, there's also, endocrine disruptors, plastics, like it's what's being done in the food. It's what's in the food. Dr. Lester always says it's a combination. It's that kids are drinking plastic water bottles and it's leaching. And then we're using those. Everyone's hearing right now about about black spatulas, so like it's the plastic surrounding our food. It's the lining in those Starbucks cups that kids are addicted to, that's a problem. And so just thinking about all this exposure and this load that we're giving our kids that then is causing their bodies to age faster. So we're seeing kids hitting puberty earlier, and that actually means that you're aging faster. If you hit puberty earlier, you've started that aging process earlier. And what the problem with that, especially for girls, is that then a lot of times we're seeing early puberty, irregular periods, and then it puts kids at a higher risk for cancer, for PCOS, for having fertility, for having functioning bodies, so that then when they do choose to have children, that they're not able to. It's happening in our kids, and I think in my generation and millennials, like we're seeing it in an extreme way, like IVF soaring, fertility issues soaring, sperm count going down. We're already seeing it. So it's not like it's just the kids. It's just that what I want people to realize is it's like, I think we all know people going through major fertility challenges, and it's only intensifying based on the health stats that we're seeing in children. And so unless we do a lot more, it's going to get worse predictably. And so that's where it's very serious and important. And it's literally whether or not a family can continue. It's whether or not it's so expensive. It's so heartbreaking. It's all consuming for people. And it's a real marker of human health and of our vibrancy. And I think, how do we do everything we can so that our kids can have the families that they want, so that they can thrive in childhood and into adulthood?
Yeah, I mean, when I think, if there isn't a more important data point, an indicator of how important this is, and to get these ultra processed foods out of our food system, and sort of certainly out of a place where the kids should be getting healthy food that improves and enriches both their health and their lives. I can't think of anything more important or impactful. So for
helps
sure.
We're hearing, one teacher just told me, she's like, real food breakfast means that in 2 years, I haven't heard one I'm hungry in class. And she's like, and my kids in math are focusing better. Like real food at school instead of the processed stuff means kids immediately don't have the tummy ache, don't have the tummy grumbles, don't have those jitters, like that they're able to sit still and be present and get that test score. And
so what does a real food breakfast and lunch look like at one of your schools?
Yeah. Oh my goodness. Also, I love school lunch and school breakfast. I crave it, which is not what I grew up on. It's so delicious. I get texts all the time from our food service directors, which are my favorite, and they what's on the menu, or they'll just tell me, hey, look what we're cooking up today. I'm like, can you Uber Eats that? Can I please get that for breakfast now? So a lot of it's like and protein is real hot right now, and it should be. How do we get kids more protein rich breakfast rather than the standard American breakfast? When you look at it for a kid, they can get 4 times the amount of sugar they're supposed to have the entire day. So we're spiking our kids. And so when you look at it like sugary yogurt and orange juice that has the fiber removed that spikes insulin, and the muffin that's more like bald cake, that's like, so as Jim Gaffigan says, it has a funny joke about that, but like muffins are just bald cupcakes or something like that. So but looking at, they're eating yogurt, what we're traditionally continental American standard American diet breakfast is pumping our kids with sugar. So if they're getting the Cinnabon or the Pop-Tart or the sugary cereal with food dyes, and then they're getting a juice or a flavored milk, and then they're starting their day in such a difficult spot. And so really we swap. So how do you swap that yogurt for a Greek yogurt with cut fruit? That's like a yogurt parfait that kids love. That's like protein rich, local, delicious, like fresh, and cool. Or like egg bites or a breakfast burrito or hot. So how do you, so there are lots of really delicious breakfast items that are more savory and that still are delicious and kids love. And then, so those are just some examples. Other things that are in schools, I'll just give a couple examples. We just celebrated Fresno Unified, which is the 3rd largest school district in California, 70,000 students. And we had, after years of hard work, they got E-Rail certified green. And I want that lunch right now. They were serving diesel organic turkey. They had a pozole with organic chicken that the kids voted that wasn't pozole unless it had cabbage and lime. So then they added that, and it was so delicious. They had buffalo chicken salad with ranch of my dreams, this fresh dill ranch that our partners at Brigade made, which is the former head chef of Noma started that. And it was they had real chefs cooking this amazing food for these kids. And so paired with our program that's so data driven and helped make it nutrient dense, delicious and local and sustainable. So that meal was amazing. And I'm leaving things
Yeah,
out.
I was thinking about Fresno. I have family that live there, and with all the farms that are there, that it would be such a perfect
Yeah, a lot of it's
area.
regionalizing. I mean, like instead of buying it from this manufacturer and having them ship it across, where can you
Hmm.
get like what's
Right.
at your local farmers market? How do we re-regionalize the food
Yeah.
system and in our country where possible? And so it's really exciting. But yeah, so
Yeah.
we're starting to do that, reconnect the dots of our entire food system around the
Right.
country, and then helping them trade recipes and talk about what's working and
Yeah.
which grass-fed beef patty are you using for that? Oh, you have to try my Thai lentil basil burger that they have in San Luis Coastal, which is also so good. So, like, oh, I'm growing my own hydroponic, lettuce in Morgan Hill. Like there's so many cool examples of amazing food systems innovation that's happening in our schools around the country. It's so
Right.
exciting.
Well, and that's, I don't know, I think it was a meme about, what's her name? I'm going to forget because I always forget when I'm doing these, but the woman who always tells everybody how to do their finances. And she's like, don't buy coffee, and you think about how much money we
Oh,
spend on, you know, ultra processed food that isn't better for us, and that it
right,
doesn't even really save time. I mean, it's not that hard to make your own cup of coffee. Don't waste
right,
money and waste your health on kind of
right.
cheap and what we perceive is easier, but in fact real food can be easy and healthful and cheaper.
3 minutes to a coffee shop, but you can make your own coffee in 3, 5. Yeah.
Right. Totally. Well, that is amazing. So we always like to talk about five good things, and of course, this has been a lot of good things.
Mhm.
Based in a system that has some bad things going on, but you're doing so much good work. But tell me a little bit about what you're most excited about in terms of where things are going and how things have kind of changed over the last few years.
Yeah, I think we're in a moment where it is really changing, and I think people have never wanted to have their health more in their hands. People are aware that something's not right. They have that feeling that you had when you got back from vacation. People are sick of feeling sick. Like 93% of Americans are cardiometabolically sick. Most Americans are walking around not feeling great. We're not, and we're learning so much. We have so much knowledge at our fingertips. And now we're also learning so much, through wearables, et cetera, about ourselves and our own bodies. And so what I'm most excited about is I think our best health as a nation is in front of us. And I personally feel that. I feel like my best health of my life, and I'm going to be 39 this month, like I think 39 can be my healthiest year yet. And I think that we can quickly make change. And while we're at a health low, we can regenerate our health as a nation and ourselves, and we can achieve the best health and restore our kids' health spans, happiness spans, and lifespans. So I think that's
Yeah.
what I'm most excited about. I like personally feel it because I see my own vibrancy and energy, and I feel so alive, and I believe our country can feel that. And I know our kids deserve it. And I know that our kids don't have it right now. Kids deserve happy, healthy childhoods, and they deserve happy, healthy lives. And so I'm most excited about that. The other thing I'm really excited about, number two, is that I believe that we can achieve our best health, and our best health is in front of us by working across the aisle. So I'm most excited that real food and real health for Americans has become a red, white, and blue issue. I think that it doesn't need to be a red versus blue issue, that this can be the American issue and the cause of our lifetime. It's become the cause of my lifetime. And I believe that across the aisle, lawmakers, individuals, communities are coming together, and that food can bring us to the table and be something we unify on, and that so that we can give our kids that better life. So I'm hopeful that we can achieve our best health as a nation, and that we can achieve it together.
That's great. I agree that we've seen a lot of improvements and a lot of discussion around this. And I think to some degree, whether it's the data or the education that has come with that, lots of, Netflix documentary that exposes things that, makes it sort of a mass understanding of what kind of the traditional American diet has done. So, and then of course,
And podcasts like yours, so thank you.
well, yes, but people like you who are doing such great work, across the country to really educate and inform, and then actually even feed our kids good food. So, thank you so much for joining me, Nora, and thank you for the work that you do. Tell our audience if they want to get in touch, if they want to learn more about the program, what's the best way to do it?
Yeah, so the best way to do it is to go to www.eatreal.org and get in touch with our team. You can join, you can reach out to us. There's a form on our website. You can reach out to us. You can reach out to us at Eat Real Certified on Instagram, on social media. I'm personally on LinkedIn, Nora LaTorre. And so, we'd love to keep the conversation going, have people reach out through our website, through social media, stay involved, become Eat Real champions, join the Eat Real movement, become supporters of Eat Real. And that's everything from becoming donors to becoming advocates to becoming champions of this movement and the knowledge building that we're doing. So
yes. And so I know that's how I met Nora, and how I reached out was on LinkedIn, but also
I have my DMs on LinkedIn. No, I love it. I love LinkedIn. We just had someone from a new state reach out yesterday. So
good. Yeah. Well, you do great amplification of the work that you do on there. So I encourage everyone to follow her and follow Eat Real, and to reach out and get your schools and communities involved in this great movement. So thanks again, Nora.
Let's do it. 2025.
Yes. Absolutely.
If we're going to launch it nationwide, we need everyone's help. It's an all hands on deck moment. So we would love it. So thank you so much.
Thank you, Nora. And this is Megan Antonelli signing off for Health Impact Digital Health Talks. And join us for our next session, exploring healthcare's digital frontier with more innovative leaders and change makers like Nora LaTorre.